Hi, I'm Dr. Julie Steinauer, and today I have a great bragging video about a patient of ours who actually turns 10 today. I'm so excited to tell you her success story, but she came in to see us back about 3 months ago, struggling with just some overall general performance in school, reading comprehension, and just some difficulty performing up to level where she needed to be. Although she's super smart, reads a lot, has a huge vocabulary, and can talk to you about such topics as, oh gosh, physics, or something crazy that you would never expect to have a conversation with a 10-year-old about. But here she is, 3 months later, after using Syntonic photo light therapy and also after working with her in vision therapy. She's having some pretty amazing success. So I've got her chart right here. I'm going to tell you some of the things that are improving for her. So one is that this young lady has had some issues with bedwetting problems, and she has an alternating eye turn out called exotropia. And when they have that, a lot of times it can be associated with bedwetting, although not all the time. But in some instances, yes, the type of kind of loose control that's given to the muscles of the eyes is kind of a loose control or lax control to the bladder as well. And so when we use photosyntonics or light therapy to tighten things up and kind of tell the brain to send a proper signal to the eyes to align and to have more of the ability to line up and not allow that eye to be kind of loose and falling out over here and going exotropic, then the same type of signaling goes to the bladder and causes the bladder to contract. So she hasn't been having any bedwetting accidents, which is super cool, because at that age, who wants to be having that? So I'm so excited for that for her. It's not what we're treating her for, but it's just kind of a bonus. So now another cool thing is her body coordination has improved dramatically. So wow, super excited to hear that she's taking tennis lessons, and her mom just says, like, it's amazing. A total and complete night and day difference in her body coordination. Watching her play tennis is just amazing, like how talented she's becoming. Another thing that's really cool, even though again we're not working on this, but this kind of talks to you a little bit about how Syntonics works. She's a right-handed individual. However, just recently she's beginning to act like she's a little bit ambidextrous. Now she's really not. And we don't have to worry that she suddenly is going to try to switch hands and have any issues with that, because she won't. But what's very cool is the signaling that goes on within the brain when you use a pair of glasses like the photosyntonic light therapy glasses. What's cool is it's an electrical signal that causes the brain to make all kinds of really amazing changes throughout the entire body. And whenever someone is utilizing them, if they happen to have a motor weakness, even if it's someone who's maybe had a stroke and they've got a motor weakness on one side, you know what we do? We tell them to get a stress squeezy ball and to squeeze that ball in that side that they're having the motor weakness, or do something like tap the leg if they're having motor weakness in the leg, because what it does is it sends that signal to that area stronger, and it can improve, almost like improving the signal strength can improve their strength or their ability to use that side of their body again. It's so amazing. So this little girl, she's not suddenly ambidextrous and going to use her left hand forever, but she's found out it's pretty cool because she's able to consciously control that left arm better, even though she's a righty. So those are some really awesome things. They're not things that we typically talk about in video, but I wanted to share those because this is her success story, and I'm super excited to share it. Now, if this sounds like someone you know, maybe it's your child, or maybe it's a niece or nephew, or just someone that you work with in, say, church or something like that, then tell them, pass along our information. Tell them to give us a call, especially if they happen to be local or within the U.S. Call us at 618-288-1489 if the idea is that they're struggling in school and maybe they have some motor weakness and some developmental delays. There might be some things that we can do. Maybe if they're still wetting the bed. Again, we're not treating bedwetting direct. We're treating vision. However, as an aside, a very cool benefit is that it actually does do some things throughout the entire body. So we can do some things if we know someone who needs vision work, which we're working with also has an issue with bedwetting, hopefully we can help them with that too. So call us again if we're 618-288-1489 if you happen to be local. If you're not, go to our website at visionforlifeworks.com, fill out the questionnaire there. That's going to kick over to us, and it allows us to get back with you via email and see what we can do to help you or your child. With that, I'm going to say thanks for tuning in. If you like the video, then like it and subscribe to our YouTube channel so you can get more of our cool video updates on a regular basis. Thank you.